I want to get right in. Secretary Kennedy made moves this week to start phasing out petroleum-based food dyes. And he also promised to, quote, get rid of every ingredient and additive in food that we can legally address. What are you guys looking at next?
It's common sense actions. I think this food dye announcement is an example of how Secretary Kennedy is going to channel really a mandate from voters not to just be concerned with Medicare, Medicaid policy, but actually the incentives of what makes kids sick. So these are petroleum-based dyes. They're in 50% of children's food. They're not allowed in any other country in the world. And until this Tuesday, the FDA said they were perfectly safe for children. So just these basic actions of taking those ingredients out of the food, the FDA has made very clear. There's 10,000 ingredients in our food in the United States that are not allowed in any other developed country's food. They said that they're going to do research on those food. They're going to steer the NIH to actually studying why we're getting sick. 90% of the NIH spending right now is on pharmaceutical R&D innovation, not on foundational reasons why we're getting sick. So they're going to steer this department step by step with common sense solutions. Additionally, another one that recently came out is SNAP. 10% of food stamp dollars go to soda. This has been something that's been talked about by both sides. We just had Senator Bennett, we've had Senator Cory Booker on the left talking about this for over a decade. Where were they when it was announced that we are finally taking soda off SNAP and working with governors? So it's common sense actions.
So on the quick question on the soda aspect, is soda going to be allowed in 5 years? Are we still going to see soda? You're going to be able to buy Diet Coke. The president's going to be able to drink it.
They've made it very clear. There's two questions. Frankly, President Trump and Secretary Kennedy are asking about that soda. Why does the soda in the United States have more ingredients than European countries? McDonald's fries in Europe have 3 ingredients. We have 17 ingredients in our food, in our fries here. Why is that? Is that the result of the free market, or is that the result of corporate capture? That's the one question about the soda they're asking. The second question about that soda is, why is it recommended to people? Literally, among the USDA guidelines for nutrition today, a Coca-Cola is valid as a nutritional item for a 2-year-old. The USDA nutrition guidelines say that added sugar can be up to 10% of a healthy 2-year-old's diet. So why are we recommending that soda to children? And why are we subsidizing it? School lunches, right now, federally funded school lunches, the top source of US calories for children, doesn't have a sugar limit for school lunches for 4-year-olds. That soda is totally okay under the current school lunch guidelines. That's not the case in any other country in the world. And we're subsidizing it with SNAP. $10 billion a year today go from the federal treasury to soda companies. Coke's about 40% of the market. That's billions of dollars that one company is getting from the supplemental nutrition program. I do think this soda SNAP announcement was very important. This was a shockwave through this town. The American Beverage Association, which is very powerful, and until Brooke Rollins came in with Secretary Kennedy, very entrenched in the USDA, this was unthinkable a year ago that this SNAP issue would be resolved. So we're really, I think, taking some real victories of the grassroots versus special interests.
And I want to ask, there's a new memo out today from Plymouth Union Public Research that found that 90% of Republican primary voters would rather have, quote, transparency in knowing what ingredients are in their food rather than having the government ban ingredients. So what do you say to folks who see it as contrary to conservatism to get the government more closely involved in what we eat?
I think every Maha mom knows that study that you just cited is totally fraudulent and funded by the soda industry, which is obvious and should be cited when you cite that study. I think that the Maha moms and conservatives made a very, very clear statement that taking a $10 billion subsidy away from soda for kids is not a violation of conservative principles. We are talking about transparency, and we are talking about cutting subsidies, and we are talking about scientific accuracy. Is there something not conservative about the USDA nutrition guidelines saying that little children should not eat added sugar and they should eat whole food? Because last year, the Biden administration released a document saying that 93% of a child's diet can be ultra-processed food and that child can still be healthy. So this is a corporate capture issue. When the American Beverage Association lobbies tens of millions of dollars to subvert our nutrition programs for low-income children and subvert our nutrition guidance, 19 out of the 20 advisors of the USDA Nutrition Guideline Committee, this past one, were paid for by the food industry or the farm industry. So correcting those structural imbalances, those bastardization of the market is an imperative for a free market. We are cutting the incentives and we are driving transparency. That's what this administration is doing. And that study is completely wrong because there was a poll, and that poll was the election. And President Trump closed the gender gap closer than anyone expected. He closed the gender gap dramatically. 50% of independents voted for President Trump. 50% of young people voted for President Trump. Unthinkable numbers. And a lot of that was driven by MAHA issues who are tired of being lectured by these totally corrupt institutions telling us that parents want their children to get government subsidized Coke.
And as you're completely, essentially revamping, as you're revamping this entire sort of industry, and you're looking at things like revamping school lunches and changing all this, how do you make sure that it is cost effective? How do you switch all of these things to Whole Foods and make sure that it is still sort of viable from a money perspective?
Good. I know we have some lobbyists from the industry in here, and I think one of the American beverage people just walked out. But this is an important. This is really important. This is really important. So I know a lot of you guys are calling the administration, and I find this very cynical. I think it should be exposed. They use the economic argument as a cudgel to have policies that they actually agree are poisoning kids. And I think one of the messages from Secretary Kennedy is we're not going to use an economic argument to subvert children's health. You know, the pharmaceutical industry says that we can afford as a country $10 billion, $1,000 a month per child who's obese of Medicaid funding for Ozempic. But we're also hearing on the other hand that we can't afford as a country to not poison our children with school lunches. There's a lot of money in the healthcare and food system. There's been over $1 trillion of agriculture subsidies spent really to prop up ultra-processed food through the lobbying in this room over the past 10 years. And then we spend $5 trillion on healthcare a year, which is 90% that goes to chronic diseases. So when you look at the federal budget, the largest parts of it are payments for healthcare and food. There's room there to really correct the market so we as a country cannot be poisoning our kids, which is what's happening. In the United States, through not the free market, through this corporate capture, 70% of our children's diet is ultra-processed food, and that is 10 to 15% in Italy, Spain, and other European countries.
And you mentioned Ozempic. You've raised concerns about Ozempic, as has the secretary. Do you want to see HHS recommend or work on alternative therapies to weight loss?
Yeah, so the MAHA perspective, from my perspective, is not a problem with Ozempic existing. But I'm curious, there's probably some people from the pharmaceutical industry. Who in this room thinks it's fair that Ozempic costs 10 times more in America than it does in Germany or Sweden? Does anyone think that's appropriate? Does anyone think it's appropriate for the American Academy of Pediatrics to recommend Ozempic for 12-year-olds, as the first-line defense before dietary interventions? Does anyone in this room think that's appropriate? Does anyone in this room, just a couple other common sense things, does anyone in this room think that we are at the moment right now for the children's vaccine schedule, that we will never have more innovation and the children's vaccine schedule will be the exact same in 10 years as in today, and that we will not be using AI or any other technology to improve the children's vaccine schedule? Does anyone believe that? I can go down the list. This is common sense. There's been people on the stage shamefully denigrating what Secretary Kennedy is trying to do. All that's being talked about in the White House from President Trump and from Secretary Kennedy is bottom line common sense questions. Ozempic is being pushed on American children as the first line defense. They fund research from Harvard explicitly, and then the head of Harvard obesity clinic says explicitly that obesity is genetic and it should be the first line defense for children. That goes into the medical guidelines. The media pumps that message relentlessly and is now calling parents anti-science for not going straight to Ozempic for their kids. And then that lays a predicate for CMS funding, where the top bill from this organization right here, literally the top priority for them, is a bill to mandate Ozempic on Medicare and eventually Medicaid for kids at a cost of $1,200 per person of taxpayer money per month. And that's 80% of adults and 40 to 50% of children. So that's how this game is played, and that doesn't make any sense. I've had great engagement with the pharmaceutical industry, with pharma, and they agree, as everyone in this room, probably some lobbyists from pharma who, agree obviously with this right now, that it's not about not having that Ozempic available, but obviously if a 12-year-old is struggling with their weight, they should be incentivized by the medical system to talk to a dietary coach, to see if they have a nutrient deficiency with their blood tests, to potentially have a targeted food intervention that's incentivized by Medicaid. Eventually, maybe if they're a 75-year-old who's morbidly obese, who's extremely diabetic, who's set in their ways, maybe that's Ozempic, sure. But it's not the standard of care. The problem is that in America, we're the most medicated country in the world, and we're the sickest, and it's correlated because we're not getting to the root cause with our medical system.
I also want to ask about there's obviously been government-wide cuts, including at HHS. And Senator Capito wrote to the secretary this week, and she asked the department to bring back coal research programs in West Virginia. She's not the only Republican who's raised concerns about the changes that Secretary Kennedy has made at HHS. So is there anything you can say to reassure them up here?
Well, I could say that it's not surprising that senators are messaging in. Healthcare is the largest and most employed industry in the United States and the fastest growing because it's predicated on more and more Americans getting sick, and that's what's happening. So in 60% of U.S. states, so 60% of U.S. senators, the largest employer in their state is a healthcare system. So they are hearing a lot from their largest employer, who, as a simple statement of economic fact, needs more sick patients. Hospitals don't make more money when beds are less full. Pharma companies don't make more money when there's less patients to pill or jab. Insurance companies don't make less money when patients get healthier, actually. So that's a dynamic that obviously there's dialogue on. I think every American needs to understand what's happening. At the highest level, Secretary Kennedy and President Trump are taking a mandate into the administration that almost everyone agrees with, which is that we have a totally unsustainable situation where we're spending 3 times more to 4 times more than European countries in healthcare costs, but living 6 to 7 years less, and have the highest rates of chronic disease, of almost every chronic disease of any country in the history of the world in America right now. There's a problem. So everyone agrees with that, and I think most people agree it's existential. It's 27% of our budget. The military is 12%, and it's growing faster. It's going to bankrupt the country. Nobody disagrees with those facts. There's they come in and they make changes, and then you can report every single hour of every single day some program that sounds good that was cut. You can give some sob story in West Virginia of some clinic that was shut down. This is the largest part of the U.S. economy. This is the largest department in government. There is a clear voter mandate for radical change, which everyone agrees is needed. And this game where I just heard a story yesterday, an NIH career official unilaterally cut a women's health program at the NIH and leaked it to the media. No approval from the top. That was directly insubordinate to President Trump's guideline to not cut core services and core research funding. Done by a career official, leaked to the media, breathless coverage about an attack on women's health, right? That person's going to be fired. Okay, that person's going to be fired. And any other person and it's happening every day, is going to be put on administrative leave. Okay, what they then do is they fund the media, quite frankly, and then there's just breathless coverage of these edge cases that are often done directly to subvert the administration, instead of coverage about the fact that 38% of teens in this country have prediabetes, and this administration is trying to attack the foundational existential chronic disease crisis. Very few articles on that. Breathless coverage of measles, breathless coverage of these sob stories that are often psyops from the government itself to subvert the Trump administration.
Is that what you feel like this one is?
I think there's absolutely mistakes.
There's
absolutely
to act on this COVID.
It's the largest department in government. It's the largest department of government. The FDA has doubled. It's doubled employee counts in the last 10 years. The cuts that Bobby Kennedy has made is less than what the Clinton administration has made. Like these are, yes, they have made changes to the largest department in government for the largest part of the U.S. economy. Like, you can point, surely there was a mistake. Surely they need to hire someone back. Surely they should have discussions with senators about reopening. But the fundamental question of whether there should be decisive and quick reform of this absolutely broken institution that is profiting every day from Americans being sick, the voters have spoken on that.
And I also want to ask, we have just a little bit of
Yeah.
time left. There's a big fight right now between the administration and Harvard.
Hmm.
Tell us a little bit about your strategy legally and sort of what your defense of this is, because it has caused a lot of drama over the past few weeks.
Yeah, I was talking to some people yesterday. I mean, Harvard's a euphemism. Harvard's done specifically really bad things, but there is a larger question here about the NIH and government grants. And I just want to talk about future government grants. Let's just go high level here, because these are the type of common sense thinking that's happening in the administration. These are the type of conversations. The question of the administration is, how can we use the taxpayer money to spur good outcomes for the American people? The NIH is a $50 billion pot of money. The mission of the NIH is to promote health and longevity for the American people. 90% of NIH grants over the past 10 years have gone to pharmaceutical R&D. I cannot find a single NIH-funded study out of Harvard that actually deals with preventing and reversal of chronic diseases, the chronic diseases that make up 90% of healthcare costs and 9 out of 10 causes of death. So what fundamentally is happening is there's a new rubric at the NIH, and that's, we are going to use this money to get actionable insights and actionable outcomes that can help our standard of care reverse and prevent chronic disease. Harvard fired professors for questioning the COVID lockdowns. They do not teach a nutrition course at Harvard Medical School. Harvard Medical School students are not allowed to say the word mother. They have to say the word birthing people. I can go on. The school is a hotbed. I'm an alum. It's a hotbed of intolerance for different opinions. 14% of grants from the NIH last year went to DEI programs. This administration is saying, instead of Brown getting millions of dollars to study DEI initiatives from NIH, we should be figuring out why children are getting autism at epidemic rates, why children are getting prediabetes, why Alzheimer's rates are cascading and younger and younger people are getting Alzheimer's. Those are the questions. Not one of those questions has been asked with the billions of dollars of grants that Harvard has gotten in previous years. So Harvard does not have a birthright to future federal grants. It is an open question whether it makes sense that our leading universities are 400 years old and we haven't had the creation of a great new academic institution in the past 100 years. The top 100 companies 100 years ago, most of them don't exist today. The great thing about America is creative destruction. Harvard saying we are science and an attack on us is an attack on science. That's like IBM saying it's an attack on innovation for them not to get billions of dollars of government grants. The whole point of innovation, the entire point of innovation is that there's continued destruction of old things and creation of new things. There's none of that in research. So this administration is asking these important questions, asking whether a school like Harvard that has demonstrated atrocious judgment in previous years has a birthright to billions of dollars of future federal funds, which I know from Harvard board members, they literally put into their models for the next 10 years of their expectations of discretionary grants. It underlies their budget for 10 years. They have a total expectation that the taxpayer is just going to give them this money. That is not appropriate. They need to drive ROI for the American people. And the NIH, this attack on the NIH, so the NIH, according to the consensus opinion of scientific leaders, funded the creation of a global pandemic. The global pandemic was funded by the NIH. That's the consensus scientific opinion. It is the consensus. Oh, the pharma lobbyists. This is great. This is great. Well, I've got some questions for you. I've got some questions for the pharma lobbyists. No, this is great. This is great. Do you guys agree that would you guys give your kids a COVID vaccine, a 6-month-year-old? Would you give your 6-month, show of hands. So you guys are against the CDC guidance. Every pharma lobbyist in here. That's interesting. Interesting. Do you guys agree that we are at the apex of vaccine innovation? There will be no changes to the childhood schedule in 10 years. Do you guys agree with that? No. No, you don't. So good, because you're arguing that there's zero vaccine innovation and we should not have any changes to the childhood schedule, which you seem to disagree with.
When you talk about vaccines,
that's good to know.
The measles vaccines, is it safe?
Hold on. I just want to correct misinformation. I think that's very important. The consensus estimation from the US government is that COVID was funded by the NIH. Go to covid.gov. You seem to be disagreeing with the government assessment, the CIA assessment, and the assessment of the health leaders of this country. So the pharmaceutical lobbyists disagree with the consensus medical view that the NIH funded gain of function research that went into the consensus estimate of where COVID came from. This is what we have here. This is what we have here. These people are jealously defending the status quo where 50% of teens are overweight or obese, where 38% of teens in America are pre-diabetic, where 1 in 20 boys in California have autism, and they're saying it's all fine. They're saying status quo. They are calling the White House and saying explicitly that we should have limited clinical trials for future drugs and future vaccines because we're building a new plant. We're spending $20 billion, so we need more lax regulations. They're explicitly saying they are a dish every single day, not disagreeing with a single word Bobby's saying, Secretary Kennedy, about the chronic disease crisis, but using promises of future investment to get lax regulation policies. That's what they're doing. It's going to be called out, and it is wrong. We want to work with the pharmaceutical industry. The vision of where we are today is that we are in a world in 10 years where the NIH is reformed, where there's accountability and truth at the NIH, where the NIH is funding and incentivizing your industry to not be studying how to profit from growing rates of Alzheimer's, but to actually solve the root cause, actually to solve the root cause of our mitochondrial health crisis and our metabolic health crisis. There's a world that we would all agree with, where industry can be incentivized to actually reverse and prevent disease. Right now, it's all about management. That is the stake in the ground, and that involves saying the truth, and it involves institutional reform that goes to the FDA and then goes to CMS to totally change how our healthcare system incentivizes care, which again, right now, 90% of spending from CMS is on management of disease. We wait for someone to get sick and then drug them. What if the system could actually incentivize reversal and prevention? That is something we can all agree on, and I would encourage the people snickering in the audience and shamefully spreading misinformation against the government consensus and the scientific consensus. I would urge you to come to this administration with wins and ideas, because whatever you think of Secretary Kennedy, whatever you think of President Trump, I don't think the distrust of healthcare and our institutions of healthcare that they tapped into, that American voters are sharing, I don't think that distrust is going away without major changes from your industry. And I know this administration wants to work constructively with you guys on joint wins to reform these devastatingly poor incentives that are leading to us being the sickest country in the developed world and the highest spending country on healthcare in the developed world. That is what the generational goal of this administration is.
Right. Well, we are more than out of time.
Thank you.
But thank you for your time. I appreciate it.
Thank you.
Thank you.